Hello doctors, I'm Nikhil here from Mission Germany, and we got Dr. Beverley with us. Her mother is also along with us. Doctor has completed her MBBS from Karnataka around couple of years back, and she's been to the process for the last around 1 to 1.5 years of time. We tried our level best to complete her process, but her process has gone late, and she should be in Germany in the coming 3-4 months of time. And I don't blame her for that, because there was some bureaucratic hurdle that we faced in Germany, and most unlucky she had some problem collecting the document from India from the university. But she's determined to go to Germany, and I think somewhere in the month of May or June she should be in Germany. She's been so motivated that for writing her B1 exam, as she was not getting the dates in India, she even traveled to Muscat to write the exam to get the process through. And I sincerely appreciate her mother and father who are meeting her for the first time to support her all the way through. But doctor, coming back to you, I want to ask a simple question. As a doctor in India, why specifically you have chosen Germany as an option to go do your specialization?
Because unlike India or unlike US, sometimes you cannot choose your specialty. It all depends on how you do on the licensing exam. But at least in Germany, you can choose your specialization. You can choose which department you want to go into, and you can choose exactly how and how far you want to go career-wise, basically. So, and it's also a country that's least explored. You should choose the path not taken by everyone. Why follow the crowd?
Lovely.
So that's why.
And what challenges you found? You see, we had a challenging time for the last 1.5 years. So you have felt the process. So tell me what challenges you faced that was really could have been improved, or the challenges which are unavoidable.
Basically, in a field like mine where everybody is a workaholic and everybody wants to constantly be in the hospital and get better on the skills, whether it's just to improve your medical training, your skills, because basically muscle memory is also very important.
Yes.
So maybe I focused more on that rather than on the language, because especially in a country like Germany where you have to know the language, maybe if I focus more on the language and getting fluent in that while also doing, practicing my skills in the hospital, maybe the language was probably what I face certain problems getting the documentation, because it's a little difficult to convince certain colleges, especially mine was a non-deemed university. So just the language and getting the documents.
So very well said, doctor. You really said it very right. Bottom line is, doctor, for all the doctors, that learning language is very important. You have to give time for it. Balancing between your work at the hospital, learning a language is always tricky. So from your side, you have to give time for it. That's the only request I can say. And mummy, from your side, you tell me, you've been in touch with me for the last 1.5 years of time. How you felt about our process in the way from Mission Germany side? Was I lacking at some place where the transparency was right or wrong? Anything that you can tell me about?
There were times that we used to lose patience, because it took some time, because there were times we were not clear from, we didn't get the clarity, and there were times where we used to lose our patience. But then at the end of the day, we understood that one who is doing it, like you are doing it, and we know what you are going through and how it happens from Germany. For us, it is the first time. And the problem was because you were in Hyderabad and we were in Mumbai and then traveling to Muscat. So it was really difficult, because conversing over the phone, it's not an easy task, and the clarity doesn't come all the time unless and until we meet you and speak to you in person, which was very important. But to our luck, we were not able to do so, to come and meet you in person. But still, we went ahead with all these processes, as you said, and we trusted in spite of not meeting you in person. So the delay, the delay was maybe because you know how the Germans work and how it goes about with them, but it helped us in some way. But but when we are not continuously in touch with you, or maybe you are busy and we could not get in touch with you, so the distance also helps a lot.
But telling me, I'll try my level best that doctor reaches Germany, and whatever recommendation and suggestions we are given, where when the distances were so much, communication was not to an extent that there was a choice of, or there was an option of misunderstanding. I'll try to work harder from my side so that those things don't come. But I thank you and respect you fully that you trusted me and giving me the work in spite of we meeting after 1.5 years of time.
Yes.
And मेरी guarantee है doctor will be in Germany. She'll just get the language, nothing more.
Yeah,
Fine.
that is the reason why we have not lost hope, and we encourage Hinga to go ahead, but not to look back.
Fine.
It will happen. The delay is there, but yes, she has to go, come what may.
It was so nice connecting with you, Doctor. Nice you came to meet me because she just traveled from Muscat around 8 hours back, just dropped today, and mom was here, so I could luckily meet them in Mumbai. But I'll be following Doctor's Beverley story in Germany, and trust me, let's all wish for her, and we should always watch for her and see that in the coming 5-6 months of time, I talk about her from Germany. So I wish her all the best, convey my regards to parents, and let's keep the patience going, let's keep the hard work going, and hope the things work out for her. Fine. Thanks a lot for connecting with us, and I wish her all the best. Thanks a lot for watching. Thank you,
Thank you,
Doctor.